Yes! Bowel movements. Bonsai! Feces away! Sometimes even the best moving bowel stops. We call this constipation. I'm Dr. Michael Berglund, and you're at Common Sense Medicine. Today we're talking about constipation. Before we get into constipation, I want to talk about how the bowel normally works and why it normally works the way it does. The bowel is separated into two parts. There's the small intestine and the large intestine. A lot of times the large intestine is referred to as the colon. The small intestine is all about absorbing and processing and pulling things out and digesting things. When we get to the large intestine, there's really not a whole lot of absorption of nutrients taking place. There's some, but not much. Just mostly it's reabsorbing water, okay? And it's acting like a septic system. It's processing the waste to get rid of it for release. The idea is we want to pull enough water out of the colon, but not too much water out of the colon. Too much water out of the colon, everything gets hard and hard to release. If we don't take enough water out, I get dehydrated. My stool flows out of me like a waterfall, which is, of course, never fun. To get the intestines to move, all right? To get them to chug along, all right? To get them to move toward their final destination, which of course is our toilet, we need to actually have what's called peristalsis. Now peristalsis is basically, wait, there's an easy way to do this. Okay, so this toothpaste is this tube, this is your colon, all right? The toothpaste, I'm sorry, is fecal material, all right? So this is, we're trying to simulate a bowel movement here. So basically what we want is, there's muscles, if you can envision it, there's muscles wrapping this tube of toothpaste, all right? And each time one contracts, it pushes, 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 pushes it out. Just like that. So what we end up with is something a little more chocolatey than that. So just like the tube of toothpaste, we want this colon to squeeze the material out. So we end up with this area in here where water gets to be reabsorbed. Okay, so there's all this happening with the idea that water is being gradually reabsorbed until we end up with 1 to 3 bowel movements per day that are formed. I don't want balls. Balls mean that it's too hard. What we want is this soft, pliable stuff to come through, squeeze, and open up the sphincter, and then everything comes out. And it should come out pretty quickly. What helps the normal bowel movements take place is fiber, all the raw materials, the food that's been broken down, and healthy bacteria. So we're going to talk about fiber, because fiber plays a key role. I would prefer that you use what's called insoluble fiber. Now insoluble fiber is stuff like psyllium husk, wheat bran, and flax fiber. So those three are really good. I don't use wheat bran because a lot of my patients are wheat sensitive. So I tend to go with either psyllium or the ground flax. What I try and do is increase that until a person gets a good bowel movement. We do a certain amount with each meal. And again, we're going for how many? 1, 2, or 3 bowel movements a day of nice, easy formed stools. If we can't get that to happen, then I usually allow in some laxatives. But the problem is, if you overdo laxatives, there's such thing as laxative colon, where people go in with colonoscopies and they can see that the whole lining of the colon is black. That means your colon's not healthy. You've been using the laxatives to get a bowel movement instead of using fiber to get a bowel movement. Use as much fiber as you need to, and then you add to a little bit of laxatives. It's important for your health. If you are reabsorbing all that water, and you're getting constipated. The problem is all that water is poopy water. And you don't want poopy water in your bloodstream. You just don't. This is Dr. Michael Berglund. This is Common Sense Medicine. We talked today about constipation.